If you've ever tried to lose weight, you know exactly what I'm talking about. The frustration. You follow the plan, you count the calories, but the results, they just don't match the effort. It feels like a total guessing game. Well, what if we could stop guessing? What if we could start measuring? Let's dive into how that's finally a reality.
Now, to really get why this matters, you have to understand the sheer scale of the problem we're facing. Right now, around 600 million adults across the globe are obese, and that number has doubled since 1980. This isn't just a few people struggling here and there. It's a massive, worldwide health challenge.
And this is exactly why experts like Walter Willett from Harvard don't just see this as a bunch of individual choices. They see it for what it is, a global epidemic. And that completely reframes the conversation. It moves it away from personal failure and towards a systemic health crisis that, frankly, needs a much better solution.
So where does all this guesswork come from? Why do so many plans, so many well-intentioned efforts just fall short? Well, the problem is baked into the very foundation of how we've been tackling weight management for, about the last 100 years.
For decades, we've all been told to eat a certain number of calories. But have you ever stopped to ask where that number actually comes from? Almost always, it's just an estimation, a prediction spit out by a formula that tries to guess what your body needs without ever, actually measuring it.
And this really shows you the two different worlds. On one side, you've got these predictive equations. Some of them were developed way back in 1919. They take your basic info and make a one-size-fits-all guess. But on the other side, you have measured metabolism, the honest-to-goodness gold standard that looks at your unique physiology. It's the difference between using a generic old-school paper map versus having a personalized GPS guiding you turn by turn.
Okay, so just how wrong can these guesses be? Well, this data from a real clinic is kind of staggering. Just look at that first patient. The formula guessed he needed about 3,700 calories. His actual measured need? Over 5,000. That's a 35% error. And then the third guy was the total opposite. The formula overestimated his needs by 17%. I mean, how are you supposed to win the game when your starting number is that far off? So this leads to the big question, right? If the old way is clearly broken, what's the new way? How do we finally move from a century of guesswork into an era of precision?
Well, the solution is a technology that's been the gold standard in research labs for years. But here's the kicker. It's finally becoming accessible to pretty much everyone. And it's called Indirect Calorimetry.
So how does it work? I know, the name Indirect Calorimetry sounds super technical, but the science behind it is actually pretty elegant. By simply measuring the oxygen you breathe in and the carbon dioxide you breathe out, we can figure out exactly how much energy or how many calories your body is burning. It's like putting your body's engine on an emissions test to see precisely how it's running.
And listen, this isn't some fringe idea. For years, major clinical publications have been calling for this to be used more widely. They know that to get better results, you have to move toward this kind of personalized care. The science has always been there. It was the accessibility that was missing.
But that is all changing. Because the real breakthrough isn't just the science itself, it's how ridiculously simple we've managed to make it.
You have to picture this. What used to be these massive, complicated metabolic carts that filled up an entire university lab have now been shrunk down. Technology has brought this gold standard measurement into a small, portable device that can be used in pretty much any clinic.
And the test for the patient? It could not be easier, seriously. After a little bit of simple prep, you just kick back, relax in a chair, and breathe normally into a little mouthpiece for about 5 minutes. That's it. No needles, no exertion, no treadmills. You just breathe. The device does all the heavy lifting, analyzing everything to give you a complete picture of your metabolism.
So, what do you actually learn from this simple little breath test? This is where it gets really, really powerful. You're not just getting one number. You're getting a detailed profile of how your body's engine truly works.
The test gives you 3 absolutely critical pieces of information. First, your resting metabolic rate, or RMR. That's your real personal calorie blueprint. Second, your respiratory quotient, or RQ. Think of this as your body's fuel gauge. And third, your mitochondrial efficiency, which tells you how well your tiny cellular engines are working.
For weight loss, though, those first two are the real game changers, so let's focus there.
And of those two, let's zoom in on the insight that is an absolute game changer for weight loss, that fuel gauge. The big question, is your body burning fat or is it burning sugar? The answer is literally hiding in your breath.
This is measured by your respiratory quotient, your RQ. It's a score that's calculated from the ratio of carbon dioxide you breathe out to the oxygen you take in. And that simple ratio tells an incredible story. Is your body running on its stored fat reserves, or is it just burning through the carbohydrates and sugars you ate recently? And this really gets to the heart of everything, because effective, sustainable weight loss is fat loss. That's the goal, right? You want your body to be tapping into its stored fat for energy. Your RQ score is the only way to know for sure if that is actually happening. It's the ultimate validation for your entire strategy.
And this visual right here shows a very common problem. The chart on the right represents a sugar-burning state, where the body is using over 80% glucose for its fuel. The goal, as you see on the left, is the opposite, to be in an optimal fat-burning state. If your body is stuck in that sugar-burning mode, it's going to be incredibly hard to lose body fat, no matter how much you restrict calories. The whole point is to shift that fuel source.
Now, this kind of precise measurement isn't just revolutionizing diet and exercise plans. It's also becoming a critical companion to the very latest medical breakthroughs we're seeing in weight management.
You've almost certainly heard about the new GLP-1 drugs that are completely changing the game for obesity treatment. They are incredibly effective at suppressing appetite, but pairing them with metabolic measurement can take their effectiveness to a whole new level. By measuring metabolism, a doctor can set precise calorie targets for someone on these drugs, making sure they're getting the right amount of fuel. They can track whether the medication is helping to shift the body into that fat-burning state, and, crucially, they can spot and counteract that dreaded metabolic slowdown that so often sabotages weight loss, making the results way more sustainable. Ultimately, what this all represents is a fundamental shift in thinking. We are moving beyond the old passive approach of just eat less, and we're finally entering an era of actively managing our metabolism, using precise data to make smart, personalized decisions that actually work. Which brings us to this final big question. Could something as simple as a 5-minute breath test, a tool that ends the guessing game once and for all and replaces it with scientific fact, be one of the most important keys we have to solving our global metabolic crisis? It really seems like we finally have the tools to find out.